We're talking this afternoon about prevention and what the church can do in the foster care crisis to prevent children from coming into foster care. I'm speaking today with Ashley Grant, our director for CompaCare in Missouri, who's been involved in this process quite a bit. And I want to pick her brains a little bit so that you understand how we emphasize prevention and how we are going to measure it, the metrics of it. So February 2018, the Department of Health and Human Services submitted a bill to the president for signing called the FFPSA, lots of acronyms, Family First Preservation Services Act. And it drastically changed the face of foster care, changed the face of institutional care by providing more preventional emphasis instead of just institutionalization. It affected the way that the institutions also must be run, and we have transformed our institutions in Arkansas to what they require it to become another acronym, QRTP, Quality Residential Treatment Program. So we're very proud of the fact that as far as that aspect of the act, we're on top of it. But our commitment is to foster care. Our commitment as an organization, we want to touch 20,000 foster children through the services of our churches. So, Ashley, explain the process of how do kids get into foster care? What is that process?
So, Johan, that usually starts with a hotline call made by a mandated reporter. And that call would trigger an investigation.
Right.
So you would have an investigator that went out and either validated the hotline call, said that probably did happen or that probably didn't happen.
Okay.
From there, if the child is in immediate danger, the child would be, emergency removed from the home. However, if they feel like they're able to work with the family and it's not an emergency issue, then they would put in something. In Missouri, we call it Intensive In-Home Services, or IIS. It's a little bit different in its vernacular in different states.
Okay.
However, it would be something that would involve the family working with somebody in their home for X number of days, and in Missouri that's 90. And if they can get the family to a place of stability within that time, then it's diverted. And what that means is that child does not come into care because they feel like they've corrected the issues that put the child in a vulnerable situation.
Okay, so you understand that the moment that there's a hotline call, the process begins. Lots of what we do in the church is already preventional. I mean, the fact that we have people coming to conversion and stopping drinking and wife beating and alcoholism and drugs, all of that is prevention, of course. All our activities to get people together, and even our Sunday school picnics. That was pre-COVID, of course. Sunday school picnics or family outings. All of this keeps families together, and that's prevention. But and we can't count that. I mean, that's just the impact of the church. But what we can count, and where we want to place the emphasis, is when this process begins. So the moment that there's a hotline call and the investigating officer then decides, here's a problem, this child needs to go immediately into care, obviously. Then it goes into the system through foster care or institutional care. But it's this other part, and that's what we want to talk about. Now, Ashley, what are some of the reasons that kids then go into care if they're not abused or if they're not severely neglected?
So a lot of that has to do with either inadequate housing.
Okay.
Could be not having food in the house. It could be not having proper childcare while the parents are at work. It could be not having utilities, something that wouldn't necessarily put the child's life or well-being in immediate danger, but something that definitely needs to be addressed.
This is something that really disturbs us, that there's a whole list of poverty-related issues or access to resources list of issues that force the caseworker to say, but the child cannot live in these circumstances. We've got to do something, so the child has to be removed. You were telling me about an example of a caseworker said, you got, what, till this weekend? Or
Yeah, we had a case come in. We're doing some of this diversion work in Missouri, and we had somebody say that this mother had until Friday to get food in her home for her son, or the child was going to be removed. And so she didn't get paid that week, and she was kind of out of ideas and had exhausted all of her resources. So we had a church donate $250, and we went to the grocery store. We loaded up a truck and took this food to her house, and that child was able to be diverted from the foster care system because the church was able to meet that immediate need.
That is so exciting. For $250, okay? We tried to figure out what it costs the state to care for these children, and it's anything, different states, from $30,000 to $60,000 a year. That's a big budget item. It's a huge budget item nationally. But if we, as the body of Christ, can get involved at an early stage, and in this case, for a $250 investment, not only do we save the state and the taxpayers, but that child remains in their parental care. Nothing is more traumatic for a child, nothing, than to be removed from the familiar circumstance. Even if we can find a wonderful, beautiful home, it's still not the same as remaining with the parents. You had another interesting example of a house that had some creepy crawlies.
Yes, there was a home where there was an infestation of bugs, and unfortunately the family didn't have the means to really get that taken care of, nor did they have another place to go, and so they were going to remove the children from the home. But we were able to find a church member who owned an extermination business, and they went out and completely cleared the home of all of the creepy crawlies. And then we had a couple of ladies that went in for the next several months and just taught the family how to keep the home clean and how to prevent that from happening in the future.
Prevention. So we can't count all the preventional work that the church does. But the things that we can count is the moment that there's a caseworker involved and the child is in imminent danger of going into care. That's the words that the Act uses, and where the emphasis ought to be lying. When a child is in imminent danger of going into care, we should place more resources there. So actually, here in Missouri, well, in Greene County, we have a special unit that looks at this. Explain that unit's role.
So we have a TDM, and it stands for Team Decision Making, and that's anytime a child is going to change placements, whether that's coming into care, leaving care, or changing foster care placements, the team meets to see if there's any way to keep that child where they're at. And so they're looking at putting in supports because we've seen and research has shown that anytime a child makes a placement change,
disastrous.
Yeah.
Emotionally, psychologically,
Exactly.
academically, spiritually.
Exactly. So they're trying to prevent the number of times a child moves, and that's what TDM means.
So Ashley connected with the TDM, and then when a child is in that precarious situation where a small intervention could make a difference, boom, they referred it to her, and we had about more than 100 kids diverted like that last year. And if you take $30,000 times 100, it's a lot of money, okay? That's just Greene County. So other states, however, do not always have a TDM.
Right.
How would a local church then find out, this child is about to go into the system, what can we do? How do they do that?
In every state, there would be some kind of unit that operates like our IIS, Intensive In-Home Services. So
Intensive In-Home Services.
Yes.
So they're the ones that get the job when it looks like...
Yes. And so if you're able to find out what that is in your state and connect with whoever runs that in your county, then you can say, hey, we're here to offer these services, and we can come alongside the workers that are going into the home to help maintain placement by providing these services.
Now, they don't have an eternity to do that.
Right. They'll only have a limited number of time, and if a diversion can be made within the 90 days, that's what it is here in Missouri, then they're able to close the case, and that child does not come into foster care. If they need more time, a lot of times they can give an extension, but if the family either doesn't comply or those needs aren't met within that amount of time, the child is removed from the home.
So you understand that there are activities that can be engaged in to keep kids out of the system, and sometimes it's as weird as getting rid of critters, and sometimes it's like there's no food. The kids don't have access to adequate nutrition. That's how we want to count our prevention measures, whether it's through a TDM or through connecting with the ISS. You got to remember all these acronyms, or the Intensive In-Home Services program. And basically, you need to find out who provides those services in your area. That's what we want to do for diversion or keeping kids out of the system.